How do hyperplastic polyps differ from other colon polyps? Imagine walking into a colonoscopy and seeing small, smooth bumps in the colon lining. Not all polyps are created equal, and understanding their differences is key to maintaining colon health. Hyperplastic polyps are among the most common types of colon polyps. They are usually tiny, less than half an inch in size, and have a very low chance of turning into cancer. These polyps are generally found in the lower part of the colon, especially in the rectum and sigmoid colon. They look like small, flat, or slightly raised bumps with a smooth surface. Unlike some other polyps, hyperplastic polyps are considered non-neoplastic, meaning they do not have the potential to become cancerous. This is a big difference from adenomatous polyps, often called adenomas, which are the most common precursors to colon cancer. Adenomas can be tubular, villous, or tubulovillous, and their risk of turning into cancer depends on their size, shape, and degree of abnormal cell growth. Larger adenomas, or those with high-grade dysplasia, are more likely to develop into cancer if not removed. Another important distinction is the histological appearance under the microscope. Hyperplastic polyps show a characteristic sawtooth pattern of the epithelial crypts but do not display cellular atypia or abnormal cell growth seen in adenomas. Sometimes, they can be mistaken for sessile serrated lesions, which are a different type of serrated polyp with a higher risk of cancer. These serrated lesions, especially those in the proximal colon, are more concerning and often requiring removal and closer follow-up. Location also helps differentiate hyperplastic polyps from other types. They are most commonly found in the distal colon, which includes the sigmoid colon and rectum. When similar serrated polyps are located in the proximal colon, they are more likely to be sessile serrated adenomas or polyps, which do carry a higher risk of progressing to cancer. From a clinical perspective, hyperplastic polyps are usually benign and do not requiring aggressive treatment. If they are small and located in the distal colon, they often do not need to be removed. However, if they are large, numerous, or found in the proximal colon, your healthcare provider might recommend removal and more regular surveillance. This is especially important if you have a family history of colon cancer or multiple polyps, as your risk could be slightly increased. In contrast, adenomatous polyps and certain serrated polyps are considered precancerous. They are typically removed when found and monitored through regular colonoscopies because of their potential to develop into colon cancer over time. Other types of polyps, like hamartomatous or inflammatory polyps, are usually benign but may be associated with genetic syndromes or underlying conditions that increase cancer risk. In summary, hyperplastic polyps are common, benign, and mostly found in the lower colon. They have minimal to no risk of becoming cancerous, unlike adenomas or certain serrated polyps, which requiring careful removal and follow-up. Knowing these differences helps doctors decide the best approach for screening and prevention, ultimately aiming to catch and treat potential problems early. Always remember, if you have concerns about colon polyps or your colon health, talking to a healthcare professional is the best step to get personalized advice and peace of mind.